7 early signs your kidneys are getting weaker after 60. YouTube script 2,000 plus words. Have you noticed that you're feeling more tired than you used to? Maybe your ankles look a little swollen at the end of the day. Maybe you're getting up to use the bathroom several times during the night. Or perhaps you've noticed that your urine looks different than it did a few years ago. Most people would simply say, "I'm getting older." And sometimes that's true. But there is one part of your body that you should never blame on aging without taking a closer look: your kidneys. Your kidneys work quietly every single day. They filter waste from your blood, help control fluid and mineral balance, support healthy blood pressure, and play an important role in making red blood cells. The surprising part is that kidney disease can develop quietly. In its early stages, many people have no symptoms at all, which means you can feel perfectly normal while kidney function is gradually changing. That is why today we're going to talk about 7 warning signs that may deserve your attention after age 60. And I want you to stay until the end, because the 7th sign is one many older adults simply dismiss as a normal part of getting older. But before we begin, remember this: having one of these symptoms does not automatically mean your kidneys are failing. Many of these symptoms can have several causes. The purpose of this video is not to scare you. It's to help you recognize when it's worth talking with your healthcare professional and getting a simple blood or urine test. So let's begin. Sign #1. Your urination pattern suddenly changes. One of the first things you may notice is a change in how often you urinate. Perhaps you're going much more frequently than before. Perhaps you're waking up several times during the night, or maybe you're producing noticeably less urine. Now, getting up once during the night can happen for many reasons, especially as we get older. But if your urination pattern has changed significantly or persistently, it's worth paying attention to. Your kidneys are constantly filtering your blood and producing urine, so changes in kidney function can sometimes be associated with changes in urination. You may notice that you're going more often. You may notice that you're going less often. Or you may notice that your nighttime trips to the bathroom have increased. But here's something very important. Don't assume every change in urination is caused by kidney disease. An enlarged prostate, urinary tract problems, diabetes, medications, caffeine, and several other conditions can change how often you urinate. That's why the goal isn't to diagnose yourself. The goal is to notice a persistent change and tell your doctor. And if you have other risk factors such as diabetes or high blood pressure, don't wait for symptoms before getting your kidneys checked, because early kidney disease often causes no obvious symptoms. Sign #2. Your urine looks foamy more often. Now let's talk about something you can actually observe. Foamy or unusually bubbly urine. Have you ever looked into the toilet and noticed a layer of foam? Occasional bubbles don't necessarily mean anything is wrong. But if your urine repeatedly looks very foamy or bubbly, especially if the change is persistent, it's something you should mention to your healthcare professional. Why? Because healthy kidneys normally keep important proteins, such as albumin, in your bloodstream. When the kidney's filtering system is damaged, protein can sometimes leak into the urine. That protein can make the urine appear unusually foamy. Think of your kidneys as an incredibly sophisticated filter. You want waste products to leave your body, but you don't want important proteins constantly leaking through the filter. That's why persistent foamy urine deserves attention. And there's good news here. You don't have to guess. A simple urine test can check for protein in the urine. So if you've noticed persistent foam, especially if it is becoming more frequent, talk with your healthcare professional. Don't panic, but don't ignore it either. Sign #3. Your feet, ankles, or hands begin to swell. Here's another change many people notice but don't always connect with their kidneys: swelling. Maybe your socks suddenly leave deeper marks around your ankles. Maybe your shoes feel tighter by the evening. Maybe your feet look puffy. Or perhaps your fingers feel swollen when you try to put on a ring. Your kidneys help regulate fluid and salt balance in the body. When kidney function is impaired, the body may retain extra fluid, which can contribute to swelling, particularly in the feet, ankles, legs, hands, or sometimes around the face. But here's another important point. Swollen legs do not automatically mean kidney disease. Heart problems, liver disease, vein problems, certain medications, and other conditions can also cause swelling. That's why you should look at the bigger picture. If swelling is new, persistent, getting worse, or accompanied by other symptoms, it's worth getting checked. Especially if you're noticing swelling together with changes in urination or unexplained fatigue. Your body may be telling you that something needs attention. Sign #4, you feel tired even after sleeping. Now let's talk about a symptom that almost everyone over 60 has experienced at some point: fatigue. The problem is that fatigue is so common that we often dismiss it. You might say, "I'm just getting older. I didn't sleep well. Maybe I didn't exercise enough." And sometimes that's exactly what is happening. But persistent or unexplained fatigue deserves a closer look. As kidney disease becomes more advanced, some people can experience fatigue, weakness, sleep problems, and difficulty concentrating. One reason is that reduced kidney function can contribute to anemia. Your kidneys normally help produce a hormone called erythropoietin, which signals your body to make red blood cells. When kidney disease becomes significant, reduced production of this hormone can contribute to anemia. And anemia can make you feel tired, weak, short of breath, or less able to do the things you normally enjoy. So imagine this. You wake up in the morning after what should have been enough sleep, you eat breakfast, you take a shower, and by 10 o'clock you're already exhausted. You don't have the energy to walk, you don't feel like doing your normal activities. You sit down more often than you used to. If this is happening repeatedly, don't simply accept it as old age. Tell your doctor. There may be a very treatable explanation. And kidney function is one of the things that can be evaluated with routine testing. Sign #5. Your skin becomes very dry or itchy. This one surprises many people. Itchy skin. Most of us automatically think of dry weather, allergies, soaps, or simply aging skin. And those causes are common, but persistent itching can also occur with kidney disease, particularly as kidney function becomes more impaired. Healthy kidneys help maintain the balance of minerals and remove waste products from your body. When kidney function declines significantly, changes in mineral balance and waste buildup can contribute to itching and dry skin. You might notice that your arms itch, your back may itch, your legs may itch, or perhaps you feel an uncomfortable itching sensation without seeing much of a rash. Again, this doesn't mean your kidneys are definitely the problem. There are dozens of reasons for itchy skin. But if the itching is persistent, severe, unexplained, or occurring together with other changes we've discussed today, bring it up at your next medical visit. Sometimes the simplest clues are the ones we overlook. Sign #6. You notice muscle cramps or weakness. Have you ever been awakened at night by a painful calf cramp? Maybe your foot suddenly tightens. Maybe your legs feel unusually weak. Or perhaps you're experiencing muscle cramps more often than you used to. Muscle cramps can have many causes. Dehydration, medications, physical activity, nerve problems, and changes in mineral levels can all play a role. Kidney disease can also be associated with muscle cramps and changes in mineral or electrolyte balance, particularly as kidney function becomes more impaired. This is why we should never look at one symptom in isolation. For example, if you're having occasional leg cramps after a long walk, that's very different from suddenly developing frequent cramps along with swelling, fatigue, changes in urination, or other unexplained symptoms. The combination matters. And please be careful with something else. Don't automatically start taking high-dose mineral supplements because you think your cramps must mean you're deficient. If your kidneys aren't working properly, certain minerals can accumulate in the body. So before starting or changing supplements, especially if you already have kidney problems, talk with your healthcare professional. Sign #7. Your appetite changes or food suddenly doesn't taste right. And now we come to a symptom that many people don't connect with kidney health at all. Changes in appetite or taste. Maybe you're not as hungry as you used to be. Maybe you feel full after eating only a small amount. Perhaps foods you normally enjoy don't taste the same. Some people with more advanced kidney disease can experience nausea, poor appetite, weight loss, or changes in taste. Why can this happen? As kidney function becomes significantly reduced, waste products can accumulate in the bloodstream. That can contribute to nausea, appetite changes, and an unpleasant taste in the mouth. But again, there are many other possible explanations. Dental problems, medications, infections, digestive disorders, depression, changes in smell, even some common illnesses can affect appetite and taste. So don't assume that a change in appetite automatically means kidney disease. But if you're losing weight without trying, eating much less than usual, feeling nauseated frequently, or noticing a persistent change in taste, talk with your healthcare professional, especially if you have diabetes, high blood pressure, heart disease, or a family history of kidney disease. Those conditions increase your risk of chronic kidney disease, the most important thing to remember. Now let me give you the most important message from this entire video. You should not wait for symptoms to check your kidneys. Why? Because early chronic kidney disease often has few or no symptoms. In fact, for many people, the only way to discover kidney disease early is through blood and urine testing. This is incredibly important after 60, especially if you have high blood pressure, diabetes, heart disease, a family history of kidney failure, or other medical conditions that may affect your kidneys. Your doctor may use a blood test called eGFR to estimate how well your kidneys are filtering blood. A urine test called UACR, or urine albumin to creatinine ratio, can look for albumin in your urine. Together, these tests can provide important information about kidney health, and sometimes the results can reveal a problem before you feel anything unusual. That's why prevention is so powerful. What can you do to protect your kidneys? So, what can you actually do? First, control your blood pressure. High blood pressure can damage the kidneys, and kidney disease can also contribute to high blood pressure. It's a relationship that can go both ways. Second, if you have diabetes, work with your healthcare team to keep your blood sugar under control. Diabetes and high blood pressure are among the most common causes of chronic kidney disease in adults. Third, be careful with medications. Some medicines, particularly certain pain relievers, can be harmful to the kidneys when used improperly or in certain people. Don't assume that because a medicine is available without a prescription, it's automatically safe for long-term use. Ask your healthcare professional or pharmacist about medications and supplements you're taking. Fourth, don't ignore persistent changes in your body. Your body doesn't always give you a dramatic warning. Sometimes it gives you a small clue, a change in urine, a little more swelling, unexplained fatigue, persistent itching, a change in appetite, and sometimes that clue is worth investigating. When should you call your doctor? Let's make this simple. If you notice persistent foamy urine, blood in your urine, significant swelling, a major change in urination, unexplained fatigue, persistent nausea, unexplained weight loss, or other concerning symptoms, contact your healthcare professional. And if you see blood in your urine, don't simply assume it's your kidneys. Blood in urine can have many causes, including urinary infections and kidney stones, and it should be evaluated. If you develop severe shortness of breath, chest pain, confusion, or a major sudden change in your condition, seek urgent medical attention. These symptoms can have serious causes and shouldn't be managed through a YouTube video. Final message. If you're over 60, I want you to remember something. Getting older doesn't mean you have to ignore changes in your body. You don't need to become obsessed with every little symptom. But you should become better at noticing patterns. If your urine changes and stays different, if your ankles keep swelling, if you're exhausted every day, if your skin becomes persistently itchy, if you're losing your appetite, these things may have completely unrelated causes. But they're worth discussing with your healthcare professional. And remember, kidney disease can be silent. You can feel fine and still have reduced kidney function. That's why a simple blood and urine check can sometimes tell you much more than your symptoms can. So if you haven't had your kidney function checked recently, especially if you have diabetes, high blood pressure, heart disease, or a family history of kidney disease, ask your healthcare professional whether testing is appropriate for you. Your kidneys work for you every single day. They quietly filter your blood. They help maintain your body's fluid and mineral balance. They support blood pressure regulation, and they play an important role in keeping your entire body functioning properly. So don't wait until you feel seriously sick to start paying attention. Know your numbers, notice the changes, ask the questions. And most importantly, remember that finding a problem early can give you and your healthcare team more opportunities to manage it. If you found this video helpful, please like this video because it helps us reach more seniors who need this information. And if you're new here, subscribe for more simple, practical health information for adults over 60. Finally, tell me in the comments, which of these 7 signs have you noticed, if any, and have you ever had your kidney function checked? Thank you for watching. Take care of yourself, listen to your body, and I'll see you in the next video. Disclaimer, this video is for general educational purposes only. It is not a diagnosis and does not replace advice from your doctor or other qualified healthcare professional. Symptoms discussed here can have many different causes. If you have concerning or worsening symptoms, seek appropriate medical care.